Now we will talk about types of health assessment. Types of health Okay, my first one is comprehensive. My second one would be problem-based. Based or focused. Third one is episodic or follow-up. I mean, they're self-explanatory, as you can see from the terminology too, but I will go over them just in a second. Fourth one is shift assessment and then screening. So when we talk about comprehensive here, as you can see even from the term there, that it is pretty much kind of like all-inclusive. It's mostly done when a patient or a client is admitted to a hospital or any kind of facility. It could be a long-term facility. They go over all the details about their health history, and they do detailed physical examination, risk factors, and all that good stuff. And it's all explained in your book too. There's a very nice table in there, so you might want to kind of read about that in more detail also. And moving on to problem-based or focused, that would be more about like a specific problem or a complaint, and it could be somebody got some kind of injury, sprained ankle, and they went to ER. So that will be more like focused or problem-based. In hospital, they might be doing okay, and then all of a sudden they start having chest pain. You want to kind of start doing that focused assessment at that time related to their cardiac system. So that will be more like focused assessment there. Episodic or follow-up, as this, this is the key term here. It would be more like if they already have a problem and they're just kind of going back to their doctor for the follow-up. It could be they were diagnosed with diabetes, and then they have to get those regular checks, and then they go see their healthcare provider for that follow-up. Or if a patient was or a client was hospitalized, and then they are told to kind of follow up with their primary care physician or healthcare provider to make sure that they're doing okay, to kind of do those other checks. Shift assessment. That's something we will be working much more in detail during this course. Shift assessment is when a nurse does that head to toe, physical examination whenever she or he starts their shift there. It could be 8-hour shift, 12-hour shift, 6-hour shift, it doesn't matter. Each nurse needs to do their own shift assessment. I want everybody to grasp that, okay? So you don't just kind of go with whatever your previous nurse told you. That might be true for them, but you have to obtain your own baseline. You have to establish your own baseline there. So I need you to really grasp that idea that you have to get that done on your shift, and it's your assessment, not copying from anybody else. They might be, seeing some other things, and there might be some change or something that got missed. With this baseline data, you have to have that, and you want to get that done as soon as possible when you start your shift, because there might be some kind of change in next hour or so. You don't want to miss that change, because if you don't have your baseline there, you're going to miss that change in your patient. So it's really, really critical there. Screening would be more about like short examination, focus more on disease detection. That could be blood pressure monitoring or screening that's done in with a healthcare provider, their primary one. Or it could be their, if they're doing any checks for screening for colorectal cancer. So those are kind of fall under those screenings. Main ones for us here are comprehensive, follow-up one, No, not the follow-up one, sorry. Focused, that we will be covering more in detail during this whole course, and your shift assessment. Other ones are important too, but I will be going more in detail about these throughout this course.